Please subscribe and like my channel, and if you have any question, then please write your question in the comment box. Good morning friends, today we will discuss about PRP. What is PRP? PRP is platelet rich plasma. In recent years, PRP has been used alongside conventional fertility treatments like in IVF to improve egg quality, uterine lining thickness, and endometrial receptivity. Primarily in the treatment of recurrent implantation failure experienced over multiple IVF cycles, while there is not yet a rich source of scientific literature showing its overall effectiveness, it is being used more and more frequently due to its clinical success. What is PRP? PRP is a concentrated blood product that contains a high percentage of platelets, biomolecules with natural healing and regenerative properties. To understand more, let us look at the blood whole. Generally, whole blood is composed of four main components. First is plasma. Plasma is a liquid component of blood that consists of mostly water, dissolved salts, and proteins. It constitutes more than half of the blood of volume and provides the medium for all the components in the blood to be transported throughout the body. The second is the platelets, also known as thrombocytes. Platelets are cells-like particles that help in the clotting process and release other substances and growth factors. The third is the red blood cells, also known as RBC. It is also known as erythrocytes. RBCs carries oxygen, which is involved in the exchange of oxygen and CO2, bringing oxygen to tissue and removing carbon dioxide from the body. The fourth one is the white blood cell, also known as leukocytes. WBC are primarily responsible for the body's immune system. The minimum endometrial thickness required for embryo transfer is 7 mm at the end of follicular phase. Endometrium is one of the main factors in pregnancy. During assisted reproductive technology treatments, some cycles are cancelled due to the inadequate endometrial growth. Now I will tell you the process of PRP, how the process of PRP occurs. About 10 ml of venous blood is taken from the patient, injected into the conical tube and centrifuged at 1500 to 1600 rpm for 12 minutes. Then the blood separates in three layers. The upper layer is platelets and WBC, middle one is buffy coats, which is rich in WBC, and the lower is RBCs. The upper and intermediate buffy coated layers are transferred to an empty sterile test tube. The plasma is centrifuged again at 2500 rpm for 20 minutes to help in formation of soft pellet at the bottom of the tube. After that, discard the upper 2/3 portion of the plasma. At this volume is platelet poor plasma. Platelets are homogenized in lower 1/3 to create PRP. 30 ml of venous blood yields 3 to 5 ml of PRP. PRP for thin endometrium. Thin endometrium is defined as an endometrium which measures less than 6 to 7 mm or 7 micrometer on transvaginal ultrasounds, and it remains the main enigmas in treatment of fertility. Intrauterine infusion of PRP is a new approach that has been suggested for the treatment of thin endometrium. PRP is infused in the endometrium using an IUI catheter, and the endometrium is measured again after 72 hours. Infusion of PRP has shown to improve the endometrial thickness and the blood flow, as well as leading to better implantation rates in IVF. Thank you.